All right. Here's what I asked Mr. Producer, Mr. Call Screener to do. To collect all the times that Obama said Obamacare won't add to the deficit. To collect all the times that Obama said you can keep your doctor or your health care policy. And to collect all the times Obama promised that he would bring down costs with Obamacare. Now, there were so many we couldn't even include them all. But let's get started, shall we? Because I noticed that the Democrats, a.k.a. the utopian statists, like to play videos of Reagan and so forth and take them out of context. We like to play audio and video of Obama and keep them in context because that's sick enough. So here we are, Obama, montage. This won't add to the deficit at all. Obamacare. Cut 9, go.
That's fully paid for, does not add 1 penny to our deficit. As badly as I think it's necessary, I won't sign it if that reform adds even 1 dime to our deficit over the next decade. And I mean what I say. First of all, I will not sign a plan that adds 1 dime to our deficits, either now or in the future. No ifs, ands, or buts. The cost of this plan will not add to our deficit. And if we're able to slow the growth of healthcare costs by just a fraction of 1% each year, we will actually reduce the deficit by $4 trillion over the long term. Really? I will not sign a plan that adds 1 dime to our deficits, either now or in the future. Importantly, this bill is also fully paid for and will reduce the deficit in the long term. And because it is paid for, this bill will help reduce our deficit by as much as $1.3 trillion in the coming decades, making it the largest deficit reduction plan in over a decade. Reducing our deficit by more than $1 trillion over the next 2 decades. That's what reform is going to do. So the bottom line is this. Our proposal is paid for.
As my parents would say, sounds like he's full of crap. So reduce the deficit $4 trillion. It will reduce the deficit $1.3 trillion. It will reduce the deficit more than $1 trillion. And in fact, it will add a fortune to the deficit because the Congressional Budget Office was finally able to do actual calculations when asked by our prior guest, Paul Ryan, to do so. Remember, back then they controlled both houses of Congress, so whatever they asked the Congressional Budget Office, the Congressional Budget Office was not free to answer fully. They could only ask the specific question asked. So, Ponzi scheme in, Ponzi scheme out. We know that this is going to cost almost $1 trillion more than Obama said. So I count 1, 2, 3, 4, 5, 6, 7, 8. This is just 9 lies right here. And Mr. Producer, you said there were many, many more cases, right?
I could have went on for 5 minutes.
5 minutes. So the president is a serial liar when it comes to his argument that Obamacare won't add to the deficit. Now, what about keeping your plan and keeping your doctor? You're not going to be able to keep your plan. That's one of the primary purposes of Obamacare. If you can't keep your plan, you're not going to keep your doctor either. And he said you would. Many, many times. Cut 10, go.
If somebody has insurance they like, they should be able to keep that insurance. If they have a doctor that they like, they should be able to keep their doctor. They should just pay less for the care that they receive. And no matter how we reform health care, I intend to keep this promise. If you like your doctor, you'll be able to keep your doctor. If you like your health care plan, you'll be able to keep your health care plan.
Liar.
So don't let people scare you. If you like what you've got, we're not going to make you change.
Oh, no.
Reform will keep the government out of your health care decisions, giving you the option to keep your coverage if you're happy with it. For the hundreds of millions of Americans who have health insurance, nothing in this plan will require you or your employer to change the coverage or the doctor you have.
This is the Obama
will change
rule.
For you if you have insurance. Nothing in the plan will require any changes.
No.
If you are happy with the insurance plan that you have right now, if the cost you're paying and the benefits you're getting are what you want them to be, then you can keep offering that same plan. Nobody will make you change it. If Americans like their doctor, they'll be keeping their doctor. You like your plan, you'll be keeping your plan. No one's taking that away from you.
Wait a minute. Really? Hold on now. Let me pull out that letter I read. Remember that letter I had yesterday, Mr. Producer? Hold on now. It's right here. United Healthcare, one of the biggest health insurance companies on the face of the earth. United Healthcare, dear member, that would be me. United Healthcare strives to provide valuable healthcare plans designed to meet the needs of our customers and their employees. And as a result of our updated plan offerings, the exact benefit plan you are currently enrolled in will no longer be offered for the upcoming plan year. Your benefits will not be affected until your plan renewal date. Over the next 90 days, we'll be working with your employer to select a new, comparable United Healthcare benefit plan, which may be available to your next benefit open enrollment period. You see, they have to factor in all the massive costs involved with all these so-called freebies that Obama's giving you, except I'm paying for them, and so are you. Now, with that in mind, Mr. Producer, it sounds to me like I can't keep my health care plan. Am I right? And if I can't keep my health care plan, I may not be able to keep my doctor. Oh, my gosh. He lied. And I know many of you are in the exact same situation. Obama's running around frantically, desperately. The Buffett rule, Reagan said this, I'm going to do that, you should do this. We don't want to go back, we only want to go forward, we don't want to go sideways, we want to go up, not down, on and on and on. As my parents would say, gladly, he's full of crap. Now let me ask you this. Will Obamacare bring down the costs of health care? Our policy's gone up over 40% since Obamacare was passed. How about you folks? He said it'll bring down the costs. Cut 11, go.
We decided to invest in reforms that'll bring costs down now. You won't have to worry about receiving a surprise bill in the mail because we'll limit the amount your insurance company can force you to pay out of your own pocket.
If you qualified, then we would provide you a little bit of help on your premiums to reduce your costs.
We will immediately offer low-cost coverage that will protect you against financial ruin if you become seriously ill.
So that's what health insurance reform would mean for you and for all our small businesses. It would reduce your costs.
Families will save on their premiums. Businesses that would see their costs rise if we do not act will save money now, and they will save money in the future. Costs will come down for families and businesses. Finally, my proposal would bring down the cost of health care for millions. Families, businesses, and the federal government.
Wow, how swell. Problem is, the opposite's true. All those clips, those 3 different montages, perfect examples of utopian statism. You heard my friend Paul Ryan tell you he read A Maritopian. Didn't you hear that, Mr. Producer? He likes the book. Well, why wouldn't you like the book? Because the book gets into this. What Obama's doing is selling you a bill of goods. Snake oil. Obama is a used car salesman. And he does the same thing every time. Whether it's health care, whether it's oil, whether it's taxes, whether it's the deficit, it comes down to one word. He lies. And if you're a utopian status, you have to lie. You have to make all these promises about what's going to happen. And it never happens. And then they demean people who speak up and are thoughtful, like Paul Ryan and many others, who say, wait a minute, we've run the numbers. Oh, scare tactics. Well, wait a minute. How are you going to expand health care coverage, deny no treatments, deny no drugs, like the way insurance companies do, quote unquote, and at the same time reduce costs? That can't work, ladies and gentlemen. That can't work, and it's not going to work. And what happens when government gets involved is the costs go way, way up, and the service goes way, way down. And then we have wage and price controls. We have redistribution of wealth. We have centralized authoritarianism, increased coercion, And you got it. Everything spirals out of control. And the only way to control it is to control you. If you just weren't so selfish, if you just weren't so successful, if you just weren't so independent, you know how they talk, we're all in this together. We're all in what together? In this financial disaster we created. We're all in it together, whether you like it or not. Listen to their language. Listen to their words. They're phony. We're all in this together. Excuse me? We're all in what together? Well, just surrender more of your liberty, your health care. Surrender your mobility, your automobile. That's right. Surrender your backyard to nature. Just keep surrendering what is yours. Surrender your soul. Then we have you. Then you don't have to worry about anything. You're dehumanized. You're perfect. You're part of the masses. Wage controls, price controls, life controls. Closer and closer to our perfect society. Our perfectly totalitarian society. That's what Obama offers you. Hold on to these montages, Mr. Producer. I don't care who steals them from us. Hold on to them. Because I'm going to play them from time to time and demonstrate exactly how utopian status talks. Because we get upset when we hear him. Sometimes we have to step back, remember what he said, and then look at what's going on. He's destroying our healthcare system. He's destroying private healthcare. He's destroying your policy, your plan. He's driving up costs. He's going to put doctors out of business. He's shutting down hospitals. He's going to create what? Scarcity. He's going to create scarcity. Scarcity creates what? Crisis. Crisis creates opportunity for the utopians.